Hello everyone, my name is Sanjay, founding director and CEO of Priority Wellness Canada Inc. I am very much thankful to TD Bank Group for funding this project of mental health support for frontline workers. We have started this series of workshops which will focus on physical, mental, spiritual, and emotional health and wellness on the ongoing basis. The intended outcome of this program is to bring to light the mental health issues that frontline workers have faced in post-pandemic situation, and they are continuing to face and find ways to improve mental health. Thank you once again to TD Bank Group. Hi, my name is Sanjay. I'm a founding director and CEO of Priority Wellness. Today I'm very much proud to introduce Angie Gill. She is a registered social worker both in Ontario and in British Columbia with a Master of Social Worker degree from the University of Windsor and Bachelor of Social Work from the University of Victoria. Angie Gill is a practice director of Social Work Evolved Inc. She brings more than 15 years of experience as a social work. Angie has specialized in case management, in neurorehabilitation services, working with individuals suffering from brain injury, spinal cord injury, and PTSD. Angie has extensive experience as a clinical social worker focusing on issues such as mental health, addictions, couple counseling, and domestic violence. So, Angie, I would like to ask you one very simple question related to, as you know, that we have gone through the COVID situation, and after COVID-19, a lot of mental health situations has developed with frontline workers as well as with in a public in general as well. You must have come across such patients during your practice, and can you please share with us and with an example or related to your individual or to the group of individuals, like in a hospital where you are also having an experience. So what do you exactly have done for the mental health improvement, and how do you help them clinically as well as to improve the mental health?
Okay. Well, first of all, thank you for the introduction. Yes, I can definitely give you some examples of the work I do. I've been in healthcare in hospitals for about 15 years now. I work directly in the emergency department. We see a lot of mental health patients who are affected both by COVID, but also other issues and challenges that add on to other pre-existing conditions. COVID has obviously made things harder for people, more stressful. So, I mean, our job as social workers in the hospital setting, we are frontline workers, is to not only provide therapeutic support to the client, but also help them link to community resources, navigate the system in terms of, accessing things that they may or may not know of. So that's a lot of what we do. I can walk you through some of the challenging cases that I've dealt with over the past 15 years. Sometimes I get a patient who comes to the Merge who has a mental health addiction issue. So mental health is one thing, they're dealing with maybe depression, schizophrenia, bipolar disorder. And then on top of that, sometimes patients are also dealing with addictions, or, whether it's alcoholism, substance use. When you put these two things together, it becomes very difficult for that client to move forward in life. Now, on top of that, you have to understand that we look at things as social workers from a holistic and systemic approach. So it's not just one problem you're facing. It's like looking at if you have an onion in your hand, you're peeling it layer after layer. There's different issues that come up, right? So, for example, like let's say I get a male patient who comes into emergency department. Patient is homeless. They also have pre-existing depression that they've been struggling with for years. Now they're also dealing with alcoholism. So that's three big issues they already have, right? So one thing we're going to try to help with is hopefully accessing housing, if that's possible. Some of these patients are bouncing back and forth between shelters. So that's one thing, is we're going to help them access housing. It's sometimes difficult to do in a hospital because, you know, the turnaround is so quick. Patients are discharged very quick, but it's our job to link with somebody in the community I guess you could say, fill that gap. So the second issue we want to address is the mental health and well-being of the patient, which is very important, right? You want to look at things like family history. Is there a family history of the mental health issue, which might be, let's say, like I said, bipolar or depression? Is the patient taking medications? If they are, can they afford them? That's another problem that I see a lot, where a patient says, you know, I don't have money to buy these medications. So that's an issue, because now they're not taking 2 steps forward, they're just going 5 steps backwards. The third issue might be, like I said, addictions. Our job is also to help that patient get access to detox, a rehab facility, you know, helping them link to a service where they're able to stop using that substance or alcohol or whatever the case might be.
Right.
In addition to that, though, like I said, you're looking at a lot of different issues, right? So finances is a big challenge for people, especially since COVID. So many people are not working or were not able to work. So the financial situation has added to the mental health and the decline in well-being of the patients that we see. So when you say, you know, are there challenges? Yeah, there's many challenges. These patients are coming in for help, right? Not only for their mental health well-being, but also other things such as, like I mentioned, the social issues like the finances, the housing, probably getting access to resources, finding a shelter that may or may not accept them, finding suitable housing for their children. You know, sometimes you get a patient who comes in who has mental health issues, but they have kids at home, and how are they supposed to support them? So we also help, as frontline workers, we help them access financing through provincial and federal financial programs. So one might be the Ontario Disability Support Program. One might be Ontario Works, which is the welfare program. So we can help them access those programs, but again, it's not a lot for that person to get by day to day, right? It's not a lot of money, and especially if they have not worked, then you're going back to this vicious cycle, right? It's hard to get out of it.
Correct. Yeah.
Yes.
Can you throw some light on frontline workers where, you know, who are facing mental health challenges specifically after the COVID-19 situation?
Yes, so I mean, a lot of frontline workers, including myself, we work long hours, several hours during COVID especially, right? We're working in hospitals. A lot of people do 12-hour shifts, sometimes even more. So a lot of the staff that I've worked with over the past couple of years have been dealing with anxiety. They've been dealing with social anxiety because, you know, sometimes you're just coming to work, you can't go anywhere after because of these lockdowns. So that's added to a lot of the decline in mental health, I guess, for staff as well. So, I mean, the goal is to obviously make sure that everyone's well supported. And so obviously the hospitals we work at, they have a lot of programs where they support us. And there is, you know, things to kind of help you therapeutically get by day to day. But it has been a lot of pressure and a lot of stress for a lot of the frontline workers because of this whole COVID situation, right? You're seeing stuff on TV, you're seeing where the numbers are, your hospital beds are full, you're doing the best you can going in day after, right? Even for myself as a social worker, you're getting a lot of mental health patients, but the pressure is on us to discharge them quickly because we need more beds. You need to make room for the next patients to come in. So mentally, it's a lot of stress. I mean, thankfully, there is a lot of support for us as frontline workers within hospitals. But what I would say is if you are dealing with that stress, you know, on your own, try to connect to either a social worker in the community or even make a call to a social worker in a hospital so you can find out what resources are available to you, right? That's our job, is to kind of educate you on what's out there for you, what you can access, and what services you may be able to afford or not afford, and how we can get around that. So navigating the system is what I'm saying. Yeah.
Correct. Thank you very much for throwing a light on the frontline worker as well as on the addictions and a couple of things which you have highlighted. I'm very much thankful for that part. And most importantly, what are the clinical challenges you must be facing when you have a mental health, when you have to improve mental health for someone when the patient comes to you? What are the clinical challenges, or what do you do exactly to, you know, improve clinically to such kind of patients suffering from mental weakness?
Yes, so I mean, clinically, we have challenges in terms of, I would say, there's always like the bigger things like budgeting and resources, right? So for us, the pressure and the challenge is, as a social worker in a hospital, I would say the biggest challenge is not enough resources and not enough, I guess you could say, beds. So there's a lot of pressure, as I mentioned before, getting the patient out quickly, right? Because there's more patients coming in. So for us, that's a lot of pressure because we can't fix a problem, a huge issue that somebody's facing, such as mental health or addiction or whatever, within a few hours. So again, our job is to connect you to the resources in the community, make sure the gap is bridged now so that you have support once you leave the hospital doors. So in a clinical sense, I would say that's pressure for us, and that's probably a big challenge. So what we do is, let's say a patient comes through the doors at emergency department, they get triaged, they come see us as a social worker or a crisis worker. We do a thorough assessment with that patient. So our thorough assessment can take anywhere from 30 to 60 minutes. We are addressing all different things, such as the family situation, previous history. Was there any trauma in the past that is triggering these current mental health issues? Is there, like I said, addictions, housing, finances? Do they have family support? Are they alone? So we do a thorough assessment to address all of these things. And after that, we kind of make a list of what's next. Does this person need a psychiatrist? Because if they do, they're in the right place, right? We can refer them to a psychiatrist in the hospital, and they may see that person that same day, or they may come back in a few weeks as an outpatient. Do they need a psychologist in the community, or do they need to go see a family doctor? So we can make those referrals as well. We also have a lot of great outpatient programs for mental health that patients can access. So we can refer within the Emerge to outpatient programs where they can access, group therapy and things like that. If the person is having maybe a mental health breakdown, maybe a psychotic episode, we can work with the family physician, the emergency physician, and then we can work on a plan where the patient is admitted. So now they're in the hospital, safe for a few days, right? They're going to get treated, they're going to get the medication they need, and they'll get the therapeutic support from the frontline worker. So that's a part of our job, is to kind of make sure that this plan happens and it's followed through. We work very closely with the emergency doctors, we work closely with the psychiatrists, we work closely with the nurses. So it's not just one person, kind of doing everything. It's, again, a very holistic approach. Everyone's working together. The patient is the main focus, their well-being is the main focus, and looking at how they can get more stable and then be stable in the community, right? You don't want them to leave the hospital and then have another mental health issue or another episode. Mm-hmm.
Thank you very much, Angie. And do you recommend, or do you and your team do the home visits, or do you do as the COVID-19 situation is getting eased out now?
Yes.
We have seen many things are now opening up very fast.
Yes.
So looking to that situation, do you do any home visits, or do you have only your clinical? Or you invite or you see patients only at your clinical facility?
Right. So in healthcare and hospital, we are not allowed to go out and do home visits, but there are agencies that do. So let's say somebody now leaves the hospital, for whatever reason, they have their mental health issues or whatever that are being assessed in the hospital. We would contact the Central West LHIN, right? So that is probably the best provider because they are funded by the government. They would be the ones who do the home visit. So whether they need a nurse, maybe an occupational therapist, physiotherapist, a social worker, to now come to the house to see them, we would put that referral in from the Emerge or from whichever hospital department to the Central West LHIN, and then it's processed through them, and then they will come up with a plan to see if they can do a home visit and how many visits the patient qualifies for. So that's actually a very good question because a lot of people don't know that. So let's say as a social worker in healthcare, I would put a referral in if somebody needs it for a social worker within community, so through the Central West LHIN. Now that social worker in the community will go and do a home visit, maybe 3 visits, maybe 4, based on their judgment, to the client to see what they can do now to help with the next steps. So just to confirm, we don't do that from the hospital, but there are agencies we would refer to who are able to do home visits. And that's very important, obviously, since COVID, because things were on lockdown, people were feeling very isolated. There was a lot of social anxiety, and the levels of anxiety for people have gone up. Not just adults, I would say kids, teenagers, obviously adults, and then obviously our geriatric patients as well. Everyone has suffered, right?
Okay, and now post looking to the post-pandemic situation, do you still see those type of mental weakness challenges with the patient, or do you see many patients before in post-pandemic situation as well, or?
Yes, definitely. I would say the number of patients that have come in from a mental health perspective has increased like a lot, right? So since the pandemic has started, I would say definitely the numbers of mental health patients have risen. The number of clients I see on a private practice basis, also the mental health numbers have risen. So it's obvious that it's affected people. The scary part is it's affecting a lot of younger people. So I have a lot of clients who tell me, you know, I feel nervous about going back to university because they've been home for so long, right, with the pandemic. They don't know how to maybe socially interact anymore, or it's not as comfortable as it used to be. I have a lot of clients and patients who are coming in with suicide ideation at a younger age, a lot of overdosing, things like that. So these are issues, obviously, that we see all the time, but I feel like it's increased a lot.
Okay, so thank you very much for giving information about the mental weakness patient suffering, and you are doing a very fantastic job to improve the mental health weakness in post-pandemic situation as well. Would you like to say something from your side to the group of our community and to the group of our people, and would you like to give some information of yours as well, if there is any such situation arising in any family member or in a surrounding community, so how they can get in touch with you or with your clinic, or what's the information you would like to share with our group?
Yes, definitely. If you or anyone you know is struggling with a mental health illness or issue, and you need some support or just some information, I would say, obviously, if it's if it's a very urgent situation, you can always call the PO Crisis Center. That's a 24-hour line that you can access, and they will walk you through the next steps of what you should do or what kind of support you can get. Obviously, if you're in an emergency situation, access any hospital in your area, and you can go to the emergency department where you will be able to get the help you need from, whether it's from a social worker or a crisis worker, somebody with that mental health background and expertise. If you have any other questions in regards to private practice therapy, you are more than welcome to visit my website, which is socialworkevolved.ca, and we can certainly do a intake with you and triage you through some of our programs and how we can help you with the therapeutic support you need for mental health.
Thank you very much. Thank you very much, and I thank Angie especially for coming by and spending your precious time with
Thank you,
with Priority
no problem.
Wellness.
Thank you.